Next question is how much of my health history will be reviewed? One of the challenges today is in the sort of healthcare system. The average doctor spends 8 to 15 minutes with a patient. So one of the limitations now with insurance is that you get sort of like the shortcut. You don't get a thorough investigation. You get a pretty quick assessment, get a pretty quick analysis, and then everybody's running full speed ahead. And when we meet with a person or their family and we discuss a case, we spend time reviewing their records before they walk through the door. And then we may ask them a lot of questions before they walk through the door. I may send a patient additional questionnaires because sometimes there's gaps in the medical record. It's kind of like I had this procedure done, 2020, and now there's something in 2022. A logical question I might have is, hey, what happened from 2020 to 2022? Where'd you go? What'd you do? And then, people feeling, well, I traveled or I didn't do treatment for whatever reason. And then basically I learned, okay, they were basically untreated for 2 years or maybe a year longer. But you kind of learn some of these details because it gives you a better sense of what could be done later to help that person. Many times people say, yeah, my doctor just read, one report and then said, here's the treatment. And you got to be careful of something like that because in that environment, when someone's approaching it, if they have a treatment plan before they know your name, that's probably not the best situation to be in. And there's some other questions later that kind of dig a little bit deeper into that.